So our next session is chaired by Les. Les is going to be reimagining the future. And also in this session, we have Cheryl from Elephant, Jenny from Jack Masters, and Yusuf from Shifa Technology. So if you'd like to switch your cameras on, guys, at some point after Les's talk and wave, and then we can go through your slides. Thank you very much.
These are principally the top issues that we have been accessed off our website as the FSB, and they're all clearly matters that are immediate and today rather than future. And I think that actually says quite a lot about the business community and where their focus is today. I think genuinely they are concerned about today and will tomorrow even arrive. And clearly SME community in various guises has taken a huge hit. So we then we then wound up in a kind of wider conversation, which is nothing to do with the Federation of Small Businesses. It's just me with my various different hats on. And I have my mantra is about reimagining the future. And the premise for that is ever so simple. And it basically says, if the future tomorrow is what we imagined it was 12 months ago, then I think we're very wrong. I think we do need to reimagine what our future now looks like. Next slide, please. So this is really interesting. So I'm just going to let this unravel. There's a phrase which you may or may not have ever come across, and it's called VUCA. And this is, oh, go back. Thank you. That'll do. And this is really, really important because this was the views of the CFOs of Unilever and Nestle, as reported in the Global Chartered Institute of Management Accountants. And this is where it gets really interesting for me about the future. So it says, we must all have an interest in the economy and our future. We look to our policymakers to create policies and initiatives that help us. We stimulate real discussion about how we achieve our business future. And then we ask what you need to design the future. Now, I'm going to assume that nobody's going to disagree with anything that's written there. What is most fascinating about that statement is that was made in 2013. And I question, therefore, what is different today than it was 8 years ago. And of course, that was being written as we were coming out of the financial recession, 28 to 2011. But I think that principle holds absolutely certain and fast that we do live in this volatile, uncertain, complex and ambiguous world. But we all do need to think about what our future looks like, and hence my phraseology of reimagining the future. Now, I'm very conscious that there was an article in the Leicester Mercury. Somebody stole reimagining, ladies and gentlemen, after we'd had a conversation. Business groups join forces to help reimagine Leicester City Centre post-COVID. Radical new thinking is needed if Leicester City Centre is going to not just survive but thrive beyond the pandemic. Can I have the next slide, please? So we'll just let these unravel, and we'll get there. Right. So following that sort of theme, and it's really interesting, and I did pick up on a comment in the last presentation about society and the social mapping side of it. So that first line there, our needy, our vulnerable, our socially isolated, with one of my other hats on, We know more today about our needy, our vulnerable, and our socially isolated than we have ever known before. And the challenge, therefore, is not only how do we keep hold of that knowledge, how do we keep hold of those people, and how do we best service and serve and look after those people. So the social sciences side of the previous presentation is actually really important. I think there is a real value added opportunity as to how we then look after society. I do have a massive question. I mentioned it earlier. How do we maintain social cohesion in a remote world? I started writing a paper last Easter, weirdly, and it was called Breaking Out into Normality. And I'm just going to, and I stopped writing it because I realized I was redesigning the entire economy, and you can't do that in a single paper. So, but I want to read you this, and it's about to sense checking our future. And it says, there's never been a more appropriate time for government, business and society to sense check their policies, plans and lives. We cannot go back to how things were. That is simply not going to be possible, practical, and in many cases desirable. One may anticipate that a notable number of workers may opt to retire early. Another group may opt to remain working from home. Another group may decide that returning to their self-imposed hectic and pressurized work-life balance is just not a viable option. Many businesses and indeed employees are already exploring a policy of permanence for remote working, but this in itself brings many medium to long-term challenges. There is significant evidence of the value of social interaction within the workplace. And as the FT.com puts it, work is often the place where you spend more time than any, and you need people that you can share confidence with or lean on. Further studies conclude that productivity and staff loyalty is higher when people have friends within their work environment, and moving to an environment that removes that physical interaction will undoubtedly bring considerable socioeconomic challenges and considerations, not just for the employer, but also for the employee. So I do think we have some fundamental challenges and questions for us all collectively to address about how do we maintain social cohesion in a remote world. City living, and I go back to the article in the Leicester Mercury, to put it crudely, I'm sick to death of people talking about city living. What we actually need to do is do it. City living is principally about remodeling city centres, reducing retail and expanding the other aspects of live, work and play. And it's been around, to my knowledge, for over a decade, but we still seem reluctant to actually do it. The next question is, what does 300 billion mean to the economy? And I've used that figure very specifically. According to the Bank of England, we have something around 150, 160 billion pounds sat in people's bank accounts and savings accounts, which has been amassed throughout COVID, primarily from furloughed staff, and people have just not been able to go out and spend money. And certainly the Bank of England expect that money to come flooding back in quite rapidly. The other part of that 300 billion, HS2, irrespective of what people think about HS2, as far as I'm aware, there's only two ways to grow an economy. One is investment-led, one is profit-led. Profit-led is a bit questionable at the minute, and therefore investment-led would seem to be a pretty good way of rebuilding our economy. That has to come from government to provide the confidence factor to allow that to happen. And HS2 is probably going to net off at about 120 billion pounds, which is a pretty good way of putting 100 and odd billion pounds into the economy. And certainly small businesses. We're there. We're in the supply chain. The other one is very topical. We are all very aware of the environmental benefits of COVID and the reduction in vehicle movements and air pollutants. We're all very conscious of that. At the moment, the Exchequer gets about £50 billion a year from fuel duty, VAT on fuel, and road fund licensing. So with the strive to electric vehicles, etc., I'm presuming, I'm not the Chancellor of the Exchequer, but I'm presuming that they will want to replace that £50 billion from other means. The next one really is just, it's a really sort of throw it out there question, because I do think this is fundamental to how we reimagine the future. And it says, what do I do with my suits? I go back to earlier. Historically, I'm a networking tart. I've probably got, I don't know, half a dozen suits in my wardrobe. Gosh, no idea how many shirts and ties that go with them. Half a dozen pair of work shoes, as we used to affectionately call them. I haven't put a suit on for a year. Now, in some respects, that's relatively minor. But if you start thinking through, if I'm not wearing a suit, if I'm not buying a suit, if I'm not wearing my work shoes, if I'm not going out to those meetings, if I'm not driving my car, if I'm not buying ties, if I'm not going out and buying meal on the go, what does that now look like? My son, technically his office is in London, and he's not been into the office since, well, I lie, he went in a couple of weeks ago to collect some bits. And in his words, and in his office is in commercial central London, is a ghost town. Now, if we're not going to go back to normal, and I will come back to this reimagining matters. A year ago, I'm fairly sure my son imagined that he would be working in a nice office suite in London for many years to come. That is now not the issue. That is not the question. That is not going to happen. His business has been quite clear. They're going to, at best, move to a hybrid mechanism. Now, if we then take that footfall out of commercial heartlands, all the fast food restaurants, all the niche cafes, how do they survive without that footfall? So what do I do with my suits? For me, is actually a monumental question that has massive potential ramifications on virtually every level I can conceivably think of. Commercial office buildings, they're nearly all owned by pension companies, VCs, investment vehicles. They're not going to sit on empty property. They're just not. Now, that does create a monumental opportunity for us to convert them into residential property. We have a fundamental shortage of property across the UK, as we're all aware. And so, you know, every cloud has a silver lining. But it then comes back to this, I guess, this bottom question. It says, has the fundamental interaction between government, society, and the economy irreversibly changed? That's a question, and I'll just leave that thought for you. And I can't remember whether there's another page. Next slide, please. There we go. Go to the end, just tick them down. We'll...
Nothing's happening, Les. I think that's it. I think we've got to the end.
Oh, I'll tell you, just hang on. No, we haven't. There should be 2 more.
Yeah.
Should be 2 more.
Hang on. Oh, it was just a little Teams glitch.
Okay. So
I think we do have to move on fairly swiftly because we're going to start
that's
eating into
fine,
people's
that's
coffee
fine.
time.
Can I just get to the bottom one? That one. Right. So this one for me is just the big thought question. Rolls-Royce, as in Aero. We are very aware that wide-body jets are being really. I know that wide-body jets are being cancelled. British Airways, the cash cow, has been for many years international business travel. Are we ever going to go back to that level of international business travel that makes it viable? I would humbly suggest no. But what does that then mean for Rolls-Royce? You know, they're one of our cutting-edge, leading, high-tech, high-value manufacturing industries. What happens? What happens if that, you know, if we are going to reduce the demand for their technology? So anyway, thoughts. It is literally, let's reimagine what the future looks like, because it ain't going to be what it was. Oh, that was the last bit. The adapters, the adopters, the innovators, and the collaborators, for me, are the ones that are going to win. And I think the latter one, the collaborators, I think the speed that the vaccine has come to life says absolutely everything. That's it.
Fabulous, Les. I think that's given us a lot of food for thought, and there is some fun in the chat as well.
I couldn't do that. I'm not good at multitask. I can't read and do that. Blooming heck.
Oh, no, I'll do that. Don't worry. So what we thought we'd then do, because I think that's fabulous. I think it's given lots of people food for thought. And then we've got 3 companies who have been working with the LLSA who've kind of had to swing their own, make their own changes, do a bit of innovation during this time. So I'm going to pass over to Cheryl and Jenny from Jack Masters, who are going to talk a little bit about some of the challenges and actually a project that they've done jointly with us. And then we'll go and speak to Youssef from Schiffer Technologies. So on you go, Cheryl.
Hello, can you see my slides okay?
We can indeed, thanks.
Excellent. Okay, I'm Cheryl. I've been working for Elephant Kiosks for about 7 years now. So a little bit of background about us. We were established in 2006 to provide accessible touchscreen kiosks for use in the public and voluntary sectors, and these were kind of information kiosks. We've moved to specialise in the healthcare market over the years, and we currently work with over 500 organisations and teams in the UK, right through from individual GP practices through to large NHS trusts like Hull University Teaching Hospitals, providing anything from information kiosks, patient feedback, software, surveys and things, through to our primary product, which is a digital self-health platform through which people can take their own health tests. So this is our primary product, our health kiosk. These kiosks can be located in GP surgeries and out in the community or the workplace. Patients can come in and use the kiosk to take clinically approved care pathway questionnaires. So these would be all the questions that you would be asked when you saw a clinician in an appointment. For example, things like the NHS health check, new patient checks, contraceptive checks, asthma, diabetes, and they can use the integrated peripherals to take their vital signs tests. So we've got a blood pressure machine, height, weight, single lead ECG and a pulse oximeter all integrated into the kiosk, and all these results are integrated straight into the patient record, so they're all SNOMED coded in a GP context, or they can be emailed out in a standalone setting. If any parameters are breached, so for example high blood pressure, the GP will get an alert and know that they need to call the patient in to be seen physically. So in response to COVID, at the start of the pandemic, we were deadly quiet, like a lot of other businesses. And then in collaboration with the University of Leicester, we developed a COVID-19 screening kiosk. So this was built on our existing digital health platform. and we integrated a forehead thermometer through Bluetooth. Mad dash to try and get those because everyone in the world wanted the thermometers. And we put the COVID-19 screening questions on the kiosk. So have you got a new cough, and those taste and smell. We provided those in a couple of different languages for the context we were going to trial them in. On screen there was instructions if a parameter was breached. So perhaps if someone had a high temperature, an email would be sent to the management. And then there would be on-screen instructions to tell the person what to do, so to go home or isolate and so on. And we worked with Leicester University to trial these in a couple of workplace contexts in Leicester, which I think you're going to hear about next. Regarding reimagining the future, I think we've had a lot of quiet time to kind of think about where we're going with our product. So our vision is, we really want to empower people to look after their own health using digital technology. And I think we sort of see a move away from GP practices, perhaps, to out in the community, workplace, pharmacies. So we'd like to get our kiosks out in those places. Not everyone has access to telehealth at home, so this would be a good opportunity for everyone to be able to access their sort of health results and sort of to monitor their own health, and hopefully that sort of fits with the NHS long-term plan on preventative healthcare and helping everyone to look after their own health. And there's just a couple of pictures of our lovely colourful kiosks for you.
Fabulous, Jenny. That's great. Cheryl, so I'm now going to hand over to Jenny from Jack Masters, and Jenny was one of the workplaces. We surveyed a lot of workplaces to find great places to place the kiosk, and Jenny was fantastically helpful, and we were able to get the kiosk in at Jack Masters. So Jenny's going to tell you a little bit about Jack Masters, and then we'll talk about how the process went. So on you go, Jenny. Thank you. You think you're on mute, Jenny?
Hi.
Hi.
Can you hear me?
Yes.
Hi, I'm Jenny. I'm the office manager for Jack Masters. I actually hadn't been with the company for very long when the pandemic hit, so I had about a month with the company, and then we were all furloughed for a little bit. But we are a knitwear company. We have a factory here in Leicester. We manufacture all of our own garments. This is just a few photos of the processes around the factory. And then here is a lovely photo of all of our staff in the Christmas jumpers that we are best known for. So we have a few brands under our belt. We make jumpers for other brands as well, but we also have our own. We make bobble hats, we make Christmas jumpers, and basically anything you could wish for. We've got about 36 employees at our factory here in Leicester, and we have been in business since 1987. During the pandemic, we actually decided to try and use our existing infrastructure to make something helpful. So we actually designed and made our own range of face masks, which are up there behind me. So we collaborated with a few local companies and the manufacturer of our knitting machines to make these face masks. So they have a space on the inside for a PM 2.5 filter, the N95 grade ones. And yeah, we sell them online and we sell them wholesale to other companies. And we just wanted to be helpful. Like a lot of other companies did things like make scrubs, but we didn't have the facilities for that. So we wanted to use what we do best and do something helpful. I think that about covers us.
Thanks, Jenny. That was great. So actually, it seemed to be that, we had this innovative development for a kiosk being driven through Professor Toru Suzuki and Elephant Kiosks. And then we had a company who was innovative, looking to, and I think you said, Jenny, you were already sort of taking people's temperatures when they were coming into the building.
Yeah, we were.
So we've just now got some of the statistic analysis back from the study, and actually what we found within your work environment, that staff felt really comforted by having the kiosk in place. They felt that their employer was taking their health and safety very seriously. And actually also we've got some data that shows that it was helping people change their behaviour about things like hands, face and space, because they were thinking about it as well. So we'll be drawing up and presenting these results at another date. But, you know, during the pandemic, I know you were new into the building. Is there anything that, you know, you would have done differently now? You know what it's, you know, it's dragged on for so long. Is there things that actually Jack Masters wish it had done differently, or do you feel that you've actually coped pretty well in the difficult sort of environment?
I think on the whole, I would say we've coped pretty well, but we started facing a lot of issues with our yarn supply. So obviously at the start of the pandemic, when it was really bad in Italy, we get a lot of yarn from Italy. So obviously that was really heavily delayed. So we started experiencing like a bottleneck because we couldn't get things knitted. And so we furloughed a lot of our staff for a long time because we didn't have work for them. But other than that, differently, I think we would have enforced mask wearing a lot sooner. Although we quite luckily we've only had one case of COVID in the factory that we know of. But we still would have separated people, maybe put some more plastic screens up and enforced mask wearing a lot sooner.